I'm Bruce Shackman. I'm the director of CHERISH, and very happy to be hosting this webinar and to kick off our series of webinars for our research affiliates and friends thereof. Very happy to see several people from Oregon on the screen here, and just to let you know that we are recording this session so that we have the opportunity to share it with some people who were not able to make the session and others as well. We realize it's earlier in the day on the West Coast, and so there's some folks in Oregon who were not able to join in real time. So we're delighted to have Jules Netherland, who's a policy member of the CHERISH Policy Advisory Board, and also Alex Kral from RTI to start this series with a discussion on evaluating drug decriminalization in Oregon, which is the first state to decriminalize possession of small amounts of all drugs. And they're going to talk about evaluating Measure 110, which many of you know is a ballot initiative that decriminalizes the possession of small amounts of all drugs and also increases access to treatment and harm reduction services in Oregon. And Drug Policy Alliance, which Jules is from, was instrumental in advocating and supporting the passage of this historic measure. And we know that other states are thinking about replicating or adopting similar initiatives and are going to be looking at the evaluation of Measure 110. So just to say a little bit more about our two speakers, Jules Netherland is the Managing Director of the Department of Research and Academic Engagement for the Drug Policy Alliance. In that role, she advances drug policy reform by supporting scholars in doing advocacy, convening experts from a range of disciplines to inform the field, and strengthening DPA's use of research and scholarship in developing and advancing its policy positions. Prior to DPA, she worked at the New York Academy of Medicine on a range of public health research and policy projects, and I was honored to collaborate with her on some of those projects when she was at NIAM. She's the editor of Critical Perspectives on Addiction, and her work with Helena Hansen on the racialization of the opioid epidemic has appeared in several journals, including the American Journal of Public Health, Biosocieties, and Cultural Psychiatry and Medicine. She holds a PhD in sociology from City University of New York Graduate Center, a master's in social work from Boston University, and a BA from Bryn Mawr College. And she's joined by Alex Kral, who's a distinguished fellow at the nonprofit research institute RTI International. Alex is an infectious disease epidemiologist with expertise in policy-relevant community-based research with urban poor populations. He is the principal investigator or co-investigator on several studies supported by the National Institute on Drug Abuse and the Laura and John Arnold Foundation that look at the relationship between infectious diseases, relationships between infectious diseases, criminal justice involvement, substance use, and poverty. He's authored or co-authored more than 200 articles in peer-reviewed journals, such as Lancet, New England Journal, JAMA, American Journal of Epidemiology, American Journal of Public Health, and Drug and Alcohol Dependence. He holds a doctoral degree in epidemiology from University of California, Berkeley, a master's degree in epidemiology from Harvard University, and a bachelor's degree from Georgetown. So thank you both for joining us. We're very excited to hear from you. If participants can share questions in the Zoom chat, we'll try to keep track of them and then allocate time at the end for the speakers to address them. So with that, take it away.
Thank you so much, Bruce. And I also want to thank Jared and all the organizers from CHERISH for having us. We're super excited to talk about this project. And Alex has been such a great partner for DPA in a number of things. And so this was something I approached him about, and I guess not long, or like a little before Measure 110 was passed, or maybe just a little bit after. So we're really excited to share this work with you. And I'm going to actually just turn it right over to Alex to talk a little bit about where the impetus for this project and where it came from.
Okay. Yes. And I also want to thank you all for inviting us here and share Jules's excitement about this, both this opportunity to speak to you all, and I'm hoping there'll be lots of discussion from it. And feel free to, ask questions or make comments along the way. I may not be able to see the chat box as I'm sharing my screen, but nonetheless, yeah. So as Jules mentioned, and she's going to talk a little bit in a minute here about Measure 110 in general and what it is, but this is the first time that a state has decriminalized all drugs in the United States, and that's an exciting thing certainly for us researchers in terms of interesting to evaluate, trying to figure out what's going on here, will it work, won't it work, what aspects of it will work, all of those things. There's so many, there's so many potential things there to look at, and no doubt, other states will be looking towards Oregon to see, should they be replicating the same kinds of law? Should they be incorporating these kinds of laws and legislators in their states? And so I think that speaks towards the importance of having good evaluations here, so that people have all the information that they need in order to make those kinds of decisions about these other states, and maybe even at the federal level at some point down the line as well. A lot of policy evaluations can be tricky to do. You all know that. There's lots of things to, if we look at past policy evaluations, especially when it gets to drug use, there's a lot of concerns and things to think about. Sometimes we see that they lack the context. It's sort of people that are looking at one or two variables. Is this one variable associated with another variable, without thinking about all the context that's involved in what's going on with those variables or people's lives, around that. So the first piece is really an attention to confounding variables. Like what are the confounding variables? And certainly to consider in Oregon on this particular topic, and we'll get into some of that. But the one that kind of sort of screaming at us is the illicit drug market, which has really shifted in the last couple of years in terms of fentanyl, and specifically in Oregon, really is kind of happening at the same time as implementation of this. And so we've got a couple of different major factors going on at the same time here, and we need to figure out how to look at that. And then, one of the things that can happen with policy evaluations is that, they're looking at questions. Any research is only as good as the research question that's asked, right? And sometimes, we find that those questions are actually not what's important to the people most directly impacted by the policy. And so that's really one of the big impetuses for us doing this particular project. And as Jules will get into, we really wanted to learn what's important to the people most directly impacted with this. The other piece, and we're already kind of seeing this a little bit in Oregon, is you've got to account for implementation issues and realities. That's that one thing is a law, and okay, well, here's the law. So what happened or not? Did it work or not? Well, sometimes policy evaluations ignore how were these implemented, or were they not implemented, or what aspects of them were implemented, and I think that's an important thing to consider as well. Evaluators, often are distant from the communities or a phenomenon, and that can be distant in terms of both geography, but also in terms of knowing and understanding or being members of those communities to understand the kinds of things that are going on within them. And then, we also have, the concern sometimes that evaluations are siloed, in terms of just looking at one particular piece, rather than looking at a whole host of issues going on. And maybe, sure, the policy changes one piece, say, to the positive, but all these other things were completely negative, and they didn't sort of study those things. And then I think we can find, and I know this is near and dear to especially this prestigious group, they can be overly focused on cost and cost effectiveness above things like morbidity or what happens to people on the what they happen to people on the ground. And finally, they can fail to account for variations or problems in implementation. I kind of talked about that a little bit above, but that's another concern. So, all of these things may go, okay, this is an important topic. People would be looking at it from around the country and even the world, I think. And we've got some things to think about in terms of how are we going to do these policy evaluations, and what are some of the traps we don't want to fall into as we do these kinds of studies and evaluations. And so I'm going to hand it over back to Jules to talk a little bit about what Measure 110 is.
Great, thanks, Alex. So I'm not going to go into depth about Measure 110. There's plenty out there for those of you who want to learn more about it. But just in broad strokes, it really was a historic measure. It was the first time that a state decriminalized drug possession for all drugs. It reclassified possession of small amounts of illicit drugs from a misdemeanor to essentially a violation with a fine. But beyond just the decriminalization of drugs, go to the next slide, Alex. The real vision of Measure 110 was to also build treatment, harm reduction, and social services infrastructure to address drug problems. So not just to get rid of criminalization, which of course is a critical piece, but also to really build a more robust infrastructure in Oregon. So it increases funding for treatment and harm reduction services. It takes some of that money from revenue from the marijuana market, and some of it from state prison savings. And those funds are being used to create addiction recovery centers, which have since been renamed to behavioral health resource networks. And there are probably people on the call from Oregon who know more about the implementation on the ground than I do. But the idea is that those centers would triage people based on their needs and then provide intensive case management, linkage to care and services, peer support, and a range of outreach. And then if you want to go to the next slide, Alex. This is all really aimed at trying to create community access to care. So it also funds low barrier substance use treatment that is supposed to be evidence-based, trauma-informed, culturally responsive, person-centered, and non-judgmental. And really importantly, also it injects a lot of funding into harm reduction interventions for people who may not be interested in stopping use or able to stop use. And that includes a range of things from syringe exchange programs to expanding access to naloxone, to education and outreach. So let me turn it back over to Alex to talk about what we did to try to inform the evaluation of Measure 110.
Yeah, so what we wanted to do then before trying to figure out, people trying to figure out how do you do evaluation, what should evaluation look like, we did this project that started by convening a small steering committee, show you the names in a minute, of folks. And to start thinking about, what do we want to look at here? What are some of the issues we want to consider? And really, the two big pieces that we came to was both looking at principles of how the research should be done, and also look at metrics. What kinds of we think are important to consider here. And that was really our guiding force was coming to an agreement. To be honest, we really started thinking about the metrics and just the metrics part. And then quickly, as a working group, got to figure out that, wait a minute, it's not just about the metrics, it's actually about how the principles of the work is being done as well. And so we developed some domains of interest and an interview guide, a qualitative interview guide. This is a qualitative effort that we then did. We conducted outreach to impacted people in Oregon. And as you'll see, try to get a geographic representation of that, throughout Oregon a bit. We conducted 11 qualitative interviews, which were about an hour each. And there was an intern, Riona Morgan at DPA, who really helped to spearhead much of the field work with this, which was great. And of course, again, this was during COVID times, and so these were interviews that were done, by Zoom. yeah, I think they were all done by Zoom. I don't think there were any phone ones. If I do you remember, Jules, did we do any by phone? I think it was all Zoom, right?
Yeah, I think we ended up being able to use Zoom for all of them.
Yeah, I think we ended up being able to do that. You know, then we analyzed the interview data to learn what we, you know, along the way to figure out what we're doing. Obviously, that was an iterative approach in terms of coming up with new domains of questions along the way. Saying, oh, well, we haven't thought of that. We should ask more about those kinds of things. You know, 11 does not sound like a large sample size. It is not necessarily a large sample size, but we got a lot of information from them, and we were kept sort of hearing the same kinds of things, and we were kind of reaching some sort of saturation, as they call it, with respect to that. Pretty early on there, after just even 10 or 11 interviews. And Jules, have you put the document in the chat box yet? I can't see the chat box. I think you were going to maybe put that in there at some point too. You'll see the list of metrics and principles is pretty long because they really came up with a lot of different things. Anyway, we drafted and reviewed some of these principles and metrics. You know, engaged the steering committee again for review so that the steering committee came back to look at those. And then we reached out back to the initial interviewees in Oregon to say, hey, look, this is the document that we've that we've created that's using the data you've given us. You know, can you provide us some input with these? Are the things that are missing? Are the things you shouldn't be on there? That sort of thing. And then incorporate that final feedback, from both the steering committee and the interviews into a final document, which I think Jules is putting in into the chat box there. The steering committee members, which we've got a list of here, includes researchers, includes folks around the country. Epidemiologists. We have legal, Corey Davis, from the legal side. We had folks in Oregon, including Michael Gilbert and Haven Wheelock, who works at a service agency in Portland. And so, we had a nice group of people who were part of this group. And, this was not a funded project. And so everyone really was a volunteer doing this work. And so they volunteered the time doing this. This is just a list here, just a map of where those 11 interviews were. They certainly were up through that corridor, what they call the I-5 corridor there, which is kind of where most of the cities are. But there's also folks that were in the more rural areas as well. Okay, so do we want to take any questions before we get to the results? Maybe I don't know how we would just take Q&A afterwards, or are there any questions in the chat already? I can't see.
There are not any questions in the chat, so I think you can carry on, and then we'll take questions at the end.
Okay, sounds good. Okay, Jules, I think you're going to lead up with the results here, yeah?
Yeah, thanks, Alex. So first, we just want to talk to you about the principles that that came out of the interviews that we did. And I think for those of us who are interested in community-driven research, these are helpful, not just for this evaluation, but probably for most evaluations. So the first one was that the people we talked to really wanted to center people who use drugs, their families in communities. Those people that were most affected by the measure, they felt not surprisingly, are the most important resource for the evaluation and need to be consulted about their experiences throughout every stage of the research process, from the proposal writing through the design and analysis, and very importantly for them, the interpretation of findings and even dissemination. So that was the first principle. The second principle is they really wanted to see comprehensive evaluations, and they meant across a range of sort of dimensions, that they wanted to see both qualitative and quantitative methods, because they wanted the qualitative data in part to offer some more sort of explanatory power to what might have been found with the quantitative data. They understood that given the data sources in Oregon, that there was going to need to be both primary data collection in addition to secondary analysis. There was a lot of skepticism about some of the administrative data that's available in Oregon, that would need to be supplemented. They also, you'll see when we get to the metrics that they wanted a really comprehensive array of domains and metrics measured. And I'll let Alex talk about those because they are quite extensive. But given the broad scope of Measure 110 and its intended impact, there were just a lot of dimensions that they wanted evaluators to look at. They also understood the importance of including not just outcome evaluation, but also process and client satisfaction evaluations as well. They wanted to make sure people were documenting selection bias, barriers to participation and follow-up, and making sure that evaluators were accounting for folks that were lost to follow-up. Anyway, there's more. I won't go through all of them, but basically they had very comprehensive views of what should be evaluated as part of measuring the success or the limitations of Measure 110. You can go to the next slide now, Alex. Thank you. They also had opinions about who should evaluate Measure 110, and they wanted researchers that had relevant experience and people that had strong understandings of public health research, but also things like how to look at racial disparities. And they really wanted folks that were from Oregon and researchers that ideally were very close to the issue or perhaps themselves had lived experience. So they wanted people who had, both sort of what we might think of as traditional expertise in terms of, credentialing, but also evaluators that would really understand the issue because they were close to it in some way or another. They wanted evaluations to be inclusive and to be of high quality. They were very concerned that that the analyses take into account a wide variety of potential confounding variables. So for instance, Alex mentioned this around implementation, but looking at increases in fentanyl when they were looking at an outcome like overdose mortality and things like that. They wanted to make sure that, they understood, I think, some of the challenges in doing effective policy evaluation. And so they wanted designs with strong comparators, which I think is a particular challenge for an evaluation like this. But that was of concern to them too. Go to the next slide, Alex. Thank you. Okay. And then they really were concerned that researchers should use language that was neutral, that it was not outdated or stigmatizing, but also that the language was comprehensible to study participants, so not too esoteric, that it should be sort of accessible and precise. And one of the things that came up in this principle and one of the other ones that I already skipped over is there was a lot of concern that drug research evaluations in general tend to focus pretty exclusively on drug users that have, quote, a problem, or have a substance use disorder. And they wanted to make sure that the evaluation, both in terms of its content, but also in terms of its language and approach, was accounting for drug users that do not have a problem, that are using drugs, but are functioning fine and don't necessarily need that kind of intervention, because they understood that those folks are often left out of our evaluations of drug policies. This principle is also perhaps not surprising, that they really wanted research to be transparent, comprehensible, and accessible to the public. They spoke strongly about how much research is sort of, never gets out of the ivory tower and isn't sort of meaningful in their lives and the lives of their community. So they wanted to make sure that prior to dissemination, that methods and results should be reviewed by people directly affected by Measure 110, as well as experts in the field. And they were recommending that there should be research liaisons who could help translate findings into impartial briefings for the community and the media, but a lot of concern to make sure that the results get out in ways that could have impact for policymakers and for community members. So in summary, there were these 6 main principles: that we should center people who use drugs, their families and communities, that The evaluation should be comprehensive across a number of domains and dimensions, that the researchers be informed and have relevant experience, that the research designs be inclusive and of high quality, that researchers avoid using stigmatizing language, and that the research methods as well as the findings be transparent and accessible. So that's what we came up with on principles. And I'm going to turn it back over to Alex to talk about metrics, because we also had lengthy conversations with people about what do they want to see measured and what would success look like if we were measuring the success of Measure 110.
Well, thanks, Jules. Yeah, so there were key domains that came up in those conversations, with people who we interviewed, who have experience directly have been directly impacted by drug use one way or the other. And here are some of the main domains. The first one, no surprise here, is that they wanted a number of things to look at regarding criminal legal data. These are sort of more obvious to us. Obviously incarceration rates, and specifically drug-related incarceration rates. Those are some of the sort of obvious ones to think about. And of course, linked to that, law enforcement interactions and culture as well. And so what happens around law enforcement? What does this change the attitudes of people who work within law enforcement towards people using drugs, towards drug use in general, by not arresting them regularly, but that's something they were very interested in learning about. 911 calls, which could go sort of one way or the other, but they were wondering if this actually might increase 911 calls, and the fact that people might feel safer that, okay, well, if I call 911, the police come. Well, if the police are not gonna be arresting you for drug-related reason, then perhaps people are more comfortable to call 911 in some sort of drug-related emergency, like an overdose. And then the other couple things that they talked about was, law enforcement interactions that involve violence. Does it somehow change that? Does it reduce that? Because there can be an escalation, I think, in some of those interactions, and does violence go? I mean, obviously go up or down, but I think they were interested in whether actually something that could be going down in some sort of way. And then finally, and as you'll see, there's a long list. I'm kind of just grabbing some of the top of the tree things that I think are interesting. This concept of net widening, that wasn't their terms, but that's a term that's been used before. It's sort of like, okay, well, if they're not going to be arresting people for drug-related things, are they going to choose other things to arrest people for? Vagrancy laws, types of things. Loitering, those kinds of laws. Are they basically going to still do the same amount of arrests, but just choose a different thing to arrest? People who are poor, people who are outside, people maybe who are experiencing homelessness, that sort of thing. And so that was something that they expressed concern about as well, and wanted to make sure that any evaluation incorporated that. The next domain was social service environment and collateral consequences of that as well. And I think that the three things that I think are important here, obviously, first of all, is availability, right? That's a big one, and given them Measure 110 is providing a lot of money towards services, and I think they're about to give out a lot of that money, in fact, to various services, both in terms of substance use treatment, but also harm reduction services and other kinds of things related to that broadly. Will there be more availability of that? That's a sort of key thing. But the a couple of things that are important there too is not just availability, but quality. What's the quality of those? You can increase all the services you want, but if the services aren't quality or they aren't good or people don't want to go to them, then that availability isn't really all that important. So you need to couple both availability with quality, and that's something that it's going to be difficult to measure. I acknowledge at times as well. And then the other thing that came up was that they were wondering, well, who's gonna work? They're increasing all these services. Who's gonna work at those sites? Who's gonna be doing all that work if they're increasing it? Which brings up the issue of a workforce. And I think we're seeing that in the U.S. in general at this point, right? There's a lot of questions about workforce, and are there good quality people and trained people available to do to be involved in doing all this social services that are now going up there. So those are some of the things that kind of came under with the social service piece. And similar to that is healthcare, right? Anything from overdoses to a host of drug-related health issues, from viruses like HIV and viral hepatitis to bacterias like soft tissue infections, endocarditis, and obviously overdose as well. And what does that what does the healthcare look like? What are some of the attitudes about that? Do those things change as well? How people are treating people, who are coming for that kind of care as well. So healthcare was a big one. Stigma, and I think Jules talked a bit about that in terms of even doing the research, but not just doing the research and who's doing the research, but also in terms of healthcare providers, social service providers, law enforcement. Does it change stigma in general in the overall population in Oregon? Is there more sort of compassion towards these issues as opposed to hatred and fear with respect to drug use? Is that something that shifts and changes over time? And then ultimately, what's important there is even self-perception. People using drugs, how do they feel about themselves? And is that something that changes over time here as well? And then the final domain was cost and cost savings. Money for how much money is actually going to be available for services. Is there a change in law enforcement and incarceration expenditures? How does that look? Not just yes, no, or how much, but what kinds of expenditures are changed or shifted? How does that shift in general? What are some of the revenues that come from this? In fact, and are they at the state level? Or or where do we see some of the revenues from this? Because that's part of what Measure 110 is thinking that will happen here as well. And obviously then, cost savings. What are the overall cost savings? Budget impact analyses, these kinds of things as well were important pieces. But we should also pay attention to some of the things that these people talked about, not just in terms of the metrics, the overall outcome metrics, but there's also they mentioned important pieces such as race, ethnicity, especially for Black, Indigenous, and people of color. Doing sub-analyses for these. How does it look for Black people versus, how does it look for white people? Does it change that or not in some sort of way? And I think, with the drug war, which has been, targeting people of color, especially Black people, Indigenous people over the years, if this is now a sort of change in this drug war kind of environment, does that play out? Now Oregon might not be the best case, state for doing this kind of research because there's actually not that large a population of BIPOC people in Oregon, but nonetheless, I think there'll probably be enough to be able to do some analysis with that, and that's important to do, especially given how they've been the most impacted by criminalization, of drug use. People mentioned geography being important, both in terms of urban, suburban, and rural, but also the frontier regions, and also they talked about sort of, poor neighborhoods and wealthy neighborhoods and how they're different and what happens in those kinds of things. And so looking specifically at income of these regions as well is an important component that they brought up. Pregnant and parenting people, that's an issue that often gets ignored, but can be the most, where drug use and criminalizing can be can have the highest impact in terms of negative impact on people. And so they talked about the importance of including sub-analyses for these groups of people. And then obviously also people, LGBTQIA folks, they talked about that and trying to see, making sure that there were metrics and there were analyses that looked at these particular groups with respect to some of those main domains that I laid out for you before this. Is this now you, Jules, or is this still me? I can't remember.
It's still you. Why don't you lead off? I'll jump in if I have something useful to say.
That would be great. That sounds good. All right. So, lots of challenges. Thanks for all these principles and metrics. Now we have to figure out how do we do this, right? Or whoever wants to do this work, there's going to be a lot of challenges involved in this. Comprehensiveness, and if you looked at the list, the list is way comprehensive. If you look at the list of things that they came up with, I only touched upon a few of these things, versus what's like possible and what's usable and what can you actually study. That's a big challenge. I think that'll be a big challenge for anyone doing evaluation of this is that tension between comprehensiveness and having, being able to, make sure you can do it. Funding for evaluation, there's some evaluation that's part of the actual measure, within Oregon. There's going to be other funders. I think, I believe actually it was included in the new NIDA RFA that came out a couple of weeks ago on harm reduction. I think they included, a piece in there. So interesting that the federal government is also interested in soliciting evaluations and research for issues regarding decriminalization. But you need a lot of funding to do all of these things, to make sure you're doing this right, to make sure you're adhering to those kinds of principles, and that you're adhering to and looking at all these kinds of metrics. You would need a large piece of funding to be able to do it right, according to the people that we interviewed with. Confounders, I mentioned this up front. This is an issue. This is definitely going to be an issue, especially when you've got one state, and Jules talked about, comparators, which they mentioned, can we use, Washington State as a comparator? And some reasons, in some ways, yes. There are other states that are similar to that. It gets tricky with just basically a sample size of one state. Confounders become a much bigger problem, and certainly looking at the piece I talked about earlier with respect to fentanyl, which hit the East Coast a long time ago, but it's really hitting the West Coast just the last couple of years most heavily. And I think Oregon, it's kind of moving into Oregon really over the last year and a half, if you look at some of the data there. COVID is also a confounder. This has now been, we're almost at the first year anniversary of this, of Measure 110 being implemented last February. The first year certainly has been, the impact of COVID and life with COVID is a huge confounding issue, as well. Dissemination is an important piece, thinking about how you disseminate, who you disseminate. There's a funding piece there. So if you're planning these kinds of evaluation projects, often researchers are like, well, part of the dissemination is, or the whole evaluation dissemination piece is, peer-reviewed, journals. And certainly that's really important. And I don't want to, say that that's not important, but you also need to consider all these things that folks mentioned here in terms of making it accessible for people, making it easy for people to learn about in language they understand. That requires beyond the sort of usual academic way of doing dissemination. It requires a lot more, and it requires thinking about that all along and having the resources to do that as well. You know, these are controversial issues. That's the other piece. I mean, the role of media and politics and all of this is difficult when you're doing this kind of research. You kind of can't do this research in a complete vacuum. And I know, you know, there's, you know, objectivity, and, you know, you should be objective as researchers and all of that. And that's, of course, incredibly important in doing rigorous science. Yeah, at the same time, you know, understanding that the way you put that science out is going to be used in various ways by both media and politicians and legislators in ways that may be unintended, and maybe you didn't intend that, or maybe people didn't quite understand the way that the science was put out there, and they assume certain things about what it is you put out there. And so I think it is important to consider the controversial issue of doing this kind of work, and most of you who are in this doing this work are certainly not naive to that particular piece. And then the last piece is just, you know, evaluation of policy level interventions. It's hard to do, and it's, you know, I think, you know, one of the things in talking about that is that piece about, you know, sort of it's one policy, or, you know, I think the piece that sort of we didn't put up here in the challenges, but you know, looking how is this actually implemented. That's a really important piece here, and because what the law was and what the measure was is one thing, and we're already seeing, you know, and I've got, you know, colleagues of mine like, you know, Gillian, I see on here now at Comagine Health, or, you know, already doing a lot of work on looking at the process evaluation. What's the process here? How is this being implemented? And making sure we don't just look at, well, did it work or didn't it work, but did it work or did not work as it was intended, but also as it was actually played out, and you know, how did it work or not work, you know, depending on how it's actually implemented. So there's a lot of challenges with doing this work, and at this point. Is this still me, Jules? I think it is, right? Or no?
Yeah, you want me to take over?
Yeah, why don't you take over, because I've been talking too much.
Well, thanks, Alex. Yeah, so I mean, we talked about sort of the impetus for doing this project, and now that it's done, we're trying to get this document into the hands of people that might be funding evaluations of Measure 110. We obviously are trying to get in the hand of researchers so that they can consider some of the both methodological and metric considerations that came out of the work that we did as they're putting together evaluations of this measure. And we're hoping to get in the hands of journal editors as well, so that when they're reviewing results from these evaluations, that they'll hopefully take some of these things into consideration. And then obviously we hope that it's going to have utility beyond Oregon. You know, as someone who works at an advocacy organization, I can tell you that the level of interest in replicating Measure 110 is very, very high in jurisdictions around the country. And so, you know, my interest from an advocacy organization is making sure that these evaluations are done in a way that really help us inform future policy efforts to decriminalize drugs, because we want to learn as much as we can from Oregon about what works and what doesn't work. And that's going to take really high quality evaluations and really thorough evaluations. So yeah, so what we've done with all of this is there's an Oversight and Accountability Commission in Oregon that is charged with a lot of the implementation of Measure 110, and this document has made it to their evaluation work group, which we're really grateful about. We've been sending it to funding agencies. We just sent an email to almost 4,000 drug policy researchers disseminating this document. It is available in our DPA's Decrim Exchange, which is sort of a resource clearinghouse for people interested in the topic of decrim, and that was the link I shared with you earlier. And then we're hoping to get it in the hands, like I said, of journal editors and perhaps even doing a journal commentary. The other thing I would say is we're hoping that this has utility in two ways. One is obviously that it influences the kinds of evaluations that are done in Oregon and beyond, but also as a way to sort of keep thinking through the challenges of community-driven research and how do you involve people directly impacted. And that's something that's been of interest to my office for a long time. And we're about to launch a series this spring on community-driven research. And actually next week, we have a talk by one of the members of the work group, Nab Dasgupta, about involving participants in his different kinds of research design. So I'll drop a link to that talk, which is next Thursday, in the chat, because this is, I think, a topic that's of interest to most of us who do drug research of how do we ensure that we're doing, policy relevant research that's high quality, but is also informed by and serves the people most directly impacted by the policies that we're seeking to change and that we're evaluating. So I think with that, we can probably open it up to questions.
Yeah, this is really, really great. And thank you so much for sharing this input. I'm sure that we're a small group, so I'm a small enough group that I think people can just unmute or raise their hands. I'm going to start off just because, certainly there are some of us who are interested in the cost and cost effectiveness evaluation comments. And in reading your document, there were definitely concerns raised by the people that you talked to about how cost evaluations would be used and that they would not be used, in the appropriate context of thinking about value. So it'd be great to hear you expand on that a little bit, because I think it's important for us to hear those voices.
Yeah, Alex, do you want to take the first stab at that?
Yeah, let me see here. I'm still unmuted, right? Yes, okay. Sorry. It is interesting, there was a lot of metrics that talked about some of those, obviously, in case, let me just see here. Just from that link specifically, here's more of the metrics that in case you didn't look at this is the part of it that is about cost and cost savings right here. I talked about some of these things, these are not economists. These are not, so they don't necessarily know all the various things that you can do there. But I think it is really important to think about some of these outcomes in terms of making sure you figure out ways, and in some ways I'm interested in hearing from you all what you think is doable here, and what kinds of data can be done here to address some of the concerns that they had, making sure that these kinds of metrics are included in analyses.
I would just add one thing. I mean, one of the things people were really concerned about that their perception, I think this is probably right, is that there's a lot of money being spent. But their concern was that just a lot of money being spent doesn't say anything about who's getting the services, the quality of the services, and how those funding decisions were being made. So they had a lot of skepticism. Basically, they were concerned that the money was not going to be well spent, and then that the outcomes would reflect that, and the measure might be seen as a failure because the money had essentially been squandered or misspent. And so that was some of their concerns, was how do we really track how those funding decisions are being made, where the money ends up, and the quality of the services that are being purchased.
Which is all near and dear to our hearts. That's exactly what I worry about, from this. So this point about description about how funding decisions are made, that leads to kind of the implementation process points that Alex was making. And if anyone from Oregon can further comment on this. How much is being, how much of is there an evaluation of how the process whereby the decisions are made as to where the money goes, and in particular, how much are people with lived experience engaged in that process? I see some nodding, Gillian nodding.
Gillian, do you want to talk a little bit about the
You can
project
unshare
Sure.
that we're doing?
Yeah, the project that Alex mentioned that we're working on right now is a process evaluation, primarily looking at the state level, just because most of the changes that have occurred that are related to getting the funding out into the community are kind of still at the state level. The burns are going to be awarded like next month. So the bulk of the funding there was an initial influx of funding that was sort of a placeholder until the burns, all of the rules related to the burns and the decisions around how the funding could get made could roll out. So our component of this process evaluation is surveying interviews with people who were involved in the OAC, the council that made the decisions around what would be funded, and then is making the funding decisions. We'll be interviewing them and people from OHA, the Oregon Health Authority, and others that were kind of involved in the process. And I'm realizing, Julia Dilly, I just saw your face on this call, who's even more engaged at the state level around how some of those decisions were being made, and is also pulling together some state level information. We do hope to, with a follow-up study with Alex as well, it's more of an outcome focus. We hopefully will be able to see at the local level then what happened with those funds once they get, aside from what those the burn grantees said they were going to do with the funds, what actually, how things unfolded within those communities will be something we can look at. But Julia, do you have anything to add to what I just said?
No, I think two things I would say. One is that the Oversight and Accountability Council, who were responsible, who that group was created as part of the measure, and their role is to design and oversee the distribution of these grants. And they're an incredible diverse group. I would probably the majority have lived experience or have worked for a long time in behavioral health services and systems. So I do feel like that's been a very engaged and pretty incredible process to watch. And, all the comments about how important it will be to understand how this thing unrolls, because, here's a great example of trying to do it right, bring together a diverse group of people who aren't government people, but do understand how communities work. They also, because they aren't government people, like there's a whole kind of a ramping up piece about bringing together a new group anyway, but then it just takes so much time to kind of come together between community, centered approaches and perspectives and government, like all the yucky mechanical gunk that we do all the time, like fitting those systems. So it takes such a long time, and it, there's some bumps in the road, and yeah. So I guess I'm just underscoring all the things you said already about how important it is to understand what the intervention is that's happening.
Well, this is we'll be really interested to hear about this, and maybe we can have you back in a while to update us on that part of the evaluation. Would be great. Just for those who are not in the know, can you just explain what a burn means?
Sure. Behavioral health resource networks, and there's a lot of different perspectives on what that means, but the idea is low barrier, community centered, and including with culturally specific expertise for service all across the state.
Great. Other questions?
Also, if I could just jump in quickly, Bruce, to answer Chris's question, is that all right?
Yep.
So just in
Can you
terms
just
of
repeat the questions?
Yeah, so there's a question in the chat about a little more description of the people that we interviewed. So to answer your question, Chris, I don't have all the demographics in front of me, but it was I think it was almost completely even between male and female. I don't believe we had any transgender folks, maybe one. They were all people who used drugs or were in recovery from using drugs. I think, as I recall, about a third to half had been justice involved. And we connected with them through a variety of means. That we had some folks on our initial working group that were very involved in the harm reduction community in Oregon, as well as with some of the, at that time, just forming drug user unions. But we also worked with people that had helped pass Measure 110 in Oregon, and looked at some of the public testimony, and identified some folks that had a vested interest in the measure that way, and then just snowball from there. So that was how we identified people.
And I think a couple, 3 of them or so were in recovery, described themselves as being in recovery as well.
Yes.
I believe. So we got a couple people that way through that as well.
Brian, can you just unmute and ask your question directly?
Sure, thank you. I'm just curious in terms of these confounding effects, if there's any research out there that's looked at how fentanyl could impact drug policy evaluations, like overdose, looking at overdose trends, if you're not accounting for an influx of fentanyl and things of that nature. If there's any models, guidance to follow.
I don't feel like I should be the only one answering that. Hopefully somebody else has a better answer than I do. I haven't seen anything like that. I think that would be really important. And I think it's going to present a huge problem in terms of how to evaluate this, because you have this, steep increase of overdoses right now in Oregon. That's going up. And if you look even on the West Coast, certainly, I'm down in California. In California, we've just, these are crazy increases, and they've just come the last couple of years. And so, yeah, I think, I don't have any easy answers to that. Has anyone else seen such models or comments about, or suggestions about how you can sort of decouple drug policy from this big influx of fentanyl and unpredictable drug market?
Ahmed, do you have any thoughts about that? I'm sorry to cold call you, and I'm not sure if you're on, but
I'm here. It's a real challenge. I think, I'm in Toronto in Canada, so it's a little bit different. I mean, we've talked about trying to get results of urine drug testing, which, and then trying to sort of aggregate that up to at a community level to try and say where fentanyl is being introduced, and but it changes what the well, I should back up for a second. The only data we have right now are data from coroner's reports. So fentanyl at the time of death, but that's obviously not a very good picture of the amount of circulating fentanyl in the environment. We have a drug checking service right now. But again, that's not a random sample of drugs. That's drugs that people can submit to be tested. And then the other possible source, as I said, is the urine drug tests, which we potentially have access to those, but it's a huge job to clean that data, and nobody's done that yet. What little we do know is that at least in Toronto, where I am, there's a lot of fentanyl. Drugs are not just fentanyl. There's a lot of fentanyl, other fentanyl analogs as well, and there are now a lot of benzodiazepines, which also being sold with fentanyl, which also complicates the picture considerably, especially when thinking about overdose. Fentanyl, most people believe that the fentanyl markets are pretty local. So even within a city, I mean, Toronto is a very large city, but within Toronto, the fentanyl markets probably vary by neighborhood. So it is a very challenging thing to look at. So I don't have any answers other than to say we thought about it and we don't have any good answers.
In Vancouver, with respect to another drug policy issue, like safe consumption sites, you had a lot of years prior to fentanyl, where you could see all these, great benefits, and then fentanyl hit and it got a lot worse. And then you see a lot of media people saying, well, look, these centers don't work because we've got way more overdoses now. It's like, well, no, that's because of the fentanyl happening, not that. And if you look at it in the pre-fentanyl area, it was helping in some sort of way. In this case, we don't have a pre-fentanyl era, measure 110 or decriminalization, and so it's going to be very difficult to decouple it, I think, in some ways.
Yeah, well, thank you. We've reached the end of the hour. Just to note that there is a commercial lab that does a lot of urine drug testing that's providing data to New York State. So if you want information about that, I can help you with that, or at least put you in touch with those folks. So thank you, everyone. There is an evaluation. We just put the link in the chat. If you can just take a minute to answer those few questions, it really helps us a lot as we plan more of these. And I just want to, honor Alex and Jules for this great work that they've done, and look forward to hearing more from other colleagues in Oregon as well as this unfolds. So thank you all.
Thank you.
you.